Without much further ado, our first speaker today is Dr. Gerald Smith. Gerald Smith is a founder and president of the International Center for Nutritional Research. He is a certified natural medical doctor, and he has a dental practice in Pennsylvania. Please give a warm Academy welcome to Dr. Smith.
I'm really excited to be here. I see a lot of my old students in here and friends. And the bottom line is dentistry has changed from when I graduated in 1969. And I'd never thought in a million years I'd be doing what I'm doing at the time that I graduated. But it's an exciting journey, and that's what it's all about. It's, you know, I always say to people, life is fun, and you come out ahead because we're all born naked and you die with a suit on. Anyway, in 1983, I wrote a book called The Dental Whole Body, or Craniodontal Sacral Complex. And little did I know that it would take me on a journey to kind of tie up what's going on with the body. And this is where the excitement is. As dentists, we have more control over the whole neurological system than any specialist in the world, if you know what you're doing. I don't waste too much time watching soap operas, so I've written a few books. The Cranial Dental Sacral Complex is a Bible, basically. It's a good reference book. And before I get started, also, I have to mention that the AGD disclaimer, I'm sorry, I do not have any financial interests of any products in my talk or with any companies offering grant monies for continuing dental and medical education. And I just stopped working for the pharmaceutical companies last week, so I'm okay. No, I'm only kidding you. Headaches Aren't Forever was an interesting book. Again, dentistry has tremendous impact on the cause of headaches, neck aches, and lower back aches. Alternative treatments for conquering pain. You know, if you look at the mouth, 46% of the motor and sensory neurons of the cortex of the brain deal with the mouth and the face. This is our area of expertise. Dental orthogonal radiographic analysis, it's the first system in the world that was designed and it actually measures cranial bone motion, documented. It's never been done before. Reversing Cancer is a book that I wrote because my wife came down with breast cancer in 97 and then ovarian cancer stage 3 in 2002. And once you see what's going on, people, it's solvable. It's absolutely solvable. They just keep perpetuating the myths about cancer. And there's a tremendous dental component in it. And the book has a whole section about the dental impact on cancer. I was president of the Holistic Dental Association and editor of their journal. And I'm excited to say that we'll be practicing 41 years come May. And I'm more excited now than ever before. My journey actually began in 1973. I attended a seminar that Nathan Shore, it's a name of the past. He was the big guru in Park Avenue in Manhattan, big TMJ, occlusal equilibration practice. And he was presenting a lecture at Temple, and he was on newer concepts of occlusal equilibration and treatment of temporomandibular joint problems. And at the coffee break, I said to him, Nathan, what's the etiology of all these symptoms that you're talking about associated with TMJ? And he said, I don't know, but maybe you'll find out. Well, that was my, I guess, seed that was planted by Dr. Shore. And over 35 years of clinical research, I've come up with a whole lot of answers. And I can honestly say that for the first time, I really know what the heck I'm doing clinically. Unfortunately, dentistry and medicine pretty much throws darts at patients because they don't see the big picture. And once you see the big picture, all the pieces of the puzzle start to come together very quickly. So some of the course objectives, learn some concepts of the dental whole body connection, which is to me very exciting because what you're dealing with in the mouth on a daily basis impacts the entire body. You're not just playing around with pearly whites. And don't think that an occlusal filling is a simple filling. Anytime you modify the occlusal table, you're impacting on the whole body. Learn some concepts of craniodontics. It's a term that I coined It's really exciting because it really focuses in on what we're doing. Learn the concepts of occlusal cranial balancing. G.V. Black would be proud if he was sitting in the audience, because I finally pieced together the true significance of the occlusion. You know, it's not just for chewing, it's not just for centric relation. It has a self-correcting mechanism for balancing the 28 bones of the skull. It's a very powerful statement. And if you understand that, you'll respect the occlusion a whole lot more. Learn why the dental complex must be treated three-dimensionally. You know, radiographically, you got 2 dimensions. You have to learn to palpate the skull using indicators, which I'm the first one in the world to put together. It's real simple. It takes 30 seconds. I can tell three-dimensionally where the cranium is in relationship to the occlusion. Learn neurological and structural importance of the occlusal revision. When you're removing amalgams and you're restoring that occlusal table, you're impacting on the whole nervous system and the cranial balance, whether you realize it or not. Occlusal revision can be a double-edged sword. You can help somebody, or you can put them into a tailspin. I'm going to show you some of these cases that were tailspins, that unfortunately, some of us, you know, when you work on a patient and they have problems, you don't see them again, you think everything's okay. But they're on a 25-year journey or a 14-year journey or whatever, looking for answers. Albert Einstein defined insanity as doing the same thing over and over again, expecting a different result. And this is what medicine and dentistry, unfortunately, has been doing for a long time. Everyone tries to dig the hole deeper, looking for that magic appliance, that magic vitamin, that magic manipulation. It doesn't exist. What does exist is an integration of many different schools of thought. And over my 40 years, I've integrated osteopathic, chiropractic, dental, medical, nutritional, physical therapy concepts. And that's what's enabled me to put together this fantastic approach to dentistry. If you remember Matrix, you must think outside of the box to solve complex problems. Neanderthal mentality has pervaded in medicine and dentistry. There's no simple solution. It's not like changing a spark plug. Every time you modify a tooth, you're impacting on the cranium, the sacrum, the spine, and the autonomic and central nervous system. Biological treatment approach focuses on a 4-letter dirty word in medicine. It's called cure. And what's it stand for? Correct the underlying reason for the error. That's the acronym. Cure. Medicine doesn't like that. It's interesting. You've never seen a race run for remission, did you? It's always run for the cure. But when you show them the cure, they do 180 degrees and run the other way. They truly do not want solutions. This has been my experience. I kept my dad alive for 13 years with congestive heart failure, and he was in an experimental group back in the 80s on medications. I called up the pharmaceutical company. I said, how long will the patients live on this drug? They said 2 years. 4 years later, my dad's the only one alive at an experimental group because I had him on a vitamin program. And I said to his cardiologist, don't you want to know what I have my dad on? He said, no. Then a whole body connection focuses on core issues. The human body is like a sports car. Okay? You have your frame, you have your skeleton, you have your motor, you have your heart, you have your computer electrical system, you have your central and autonomic nervous system, you have your fuel, you have your digestion, you have your vehicle stability assist, and that's what the occlusion is. Vehicle stability assist. If your bite is not right, you cannot stabilize the spine, pelvis, and sacrum. Craniodontics. It's an integration of orthopedics, orthodontics, and cranial principles. See, people have not looked at the dental component as a far-reaching paradigm, but it is. Diagnosis and treatment of cranial distortions caused by malocclusions and occlusal irregularities. I'm telling you, people, you could have an interference that's so minuscule, but yet so far-reaching. We just had a captain in the U.S. military flew up from North Carolina on Monday. She woke up in March of 2007, couldn't move her neck, been in pain for 3 years. Went to Walter Reed Army Medical, Pentagon doctors, University of North Carolina at Chapel Hill. Nobody could fix her. She came in. She had pronated feet, which puts a torque in the spine all the way up into your head. She had a spastic diaphragm from a whiplash injury. She had a cranial distortion and orthodontics, which created a minor interference on tooth number 18, lower left second molar. In 1 hour, I got her 100% out of pain because we supported the feet, released the diaphragm, adjusted the skull, and took the one minor interference out, and the whole body relaxed, and the pain totally disappeared. This is what dentistry is all about if you know what you're doing. You cannot look at the teeth as isolated parts of a mannequin. They're attached to nerves. I believe that craniodontics represents one of the biggest breakthroughs in the history of medicine and dentistry because now we have control over the whole nervous system instead of just using medication to suppress symptoms. Craniodontics basically is the missing link between conventional dentistry and biological dentistry, and even a chimp can figure that out. This seems like a bold statement. 70 to 90% of all medical problems have a dental origin. When I first heard it from Dietrich Klinghardt, he said 70%, but after practicing all the years that I have and doing what I'm doing, I had to up it to 90%. And it seems maybe out of proportion, but once you understand the mechanisms that are going on, you'll see that I'm right. Dental factors provide a major influence in the rise of degenerative diseases, structural problems, chronic illness, and cancer. A year ago, we had a patient referred to us with stage 4 throat cancer. He had an infected root canal tooth and another tooth that had no restorations on it, but it was infected. We removed it. We put ozone up into the surgical site, homeopathic remedies, Sanum remedies, and ionic silver. Put him on a raw juice diet, raw foods. He had IPT treatment. In 3 weeks, people, the cancer totally disappeared, documented with PET scans, blood tests, and visual. 3 weeks, cancer disappeared. If you remove the core issues, the disease process clears up. See, just drilling the mercury filling out of the tooth is part of the process. You have to detox the body and the tissues of that mercury. If you don't, you're setting these people up for chronic illnesses. The dental connections. The occlusion provides the third point that stabilizes the atlas. If you look at the human spine, there's a 3-point contact in every vertebrae in the entire spine, with the exception of the atlas, which is your first cervical vertebrae. The point that stabilizes the atlas is the occlusion. So that's why, invariably, when you have malocclusions, you always have upper cervical instability. And the reverse is true. You get a whiplash injury, you get a hypolordosis, they lose the curve in the neck, the occlusion's off. They go to the dentist because they're hitting on the one tooth and it's sore, and he grinds down that high spot. Now the dentist has locked that patient into a compensation position for the rest of their life. The occlusion provides the self-correcting mechanism for balancing the entire cranium. Every time you swallow, which is 2 to 3 times a minute, you're rebalancing that skull. If that skull's not rebalanced, you're going to have far-reaching effects. The center of rotation of mandible is the odontoid process. At the odontoid process, you have that superior cervical ganglion that lies at the same level. Embryologically, the anterior teeth develop from your neural tube, which gives rise to your sympathetic nervous system. Okay. And embryologically, your posterior teeth develop from the neural crest cells, which gives rise to your parasympathetic nervous system. There's your yin and yang, your balance. Front teeth sympathetic, posterior teeth parasympathetic. The teeth are connected, they're circuit breakers to your spine that relate to organs and muscles and tissues. And every time you have a problem with a tooth, it can reflex back into the spine and trigger off dysfunction. And vice versa. You could have a weak adrenals from being stressed out, mercury toxic, cadmium toxic, aluminum toxic, and have a lower molar that's in pain because the lower molar can be related to the adrenals. It's a circuit. It's a two-way circuit, people. Lymphatics from the teeth pass to your submandibular and your deep cervical nodes. The lymphatic vessels from your thyroid gland communicate with these deep cervical nodes via the superior thyroid vessels. The soft and hard tissues of the mouth drain to superior cervical ganglion, or your nodes. Your anterior part of the floor of the mouth drains via the submental nodes or directly to your superior deep cervical nodes. All dental materials or infections that leak out from your teeth, the gingiva, and your jawbones will ultimately pass through the thyroid. I treat more thyroid patients than most medical doctors do in a lifetime. Why? Because every and any problem that exists in the mouth, especially toxicity and infections, migrate to the thyroid. And these vaccines that they're putting into our children, and even some adults that are non-thinking, they're getting trapped in the thyroid, people. I treat autistic children, and I'm finding that tetanus is one of the biggest problems with autistic children. It's getting trapped in the thyroid. When you start to see the far-reaching effect of what you're doing to the mouth, now you know why you're impacting 70 to 90% of all medical problems. We've had congestive heart failure patients. I had one flew in from Seoul, Korea, congestive heart failure for 10 years, coming from a strep infection in a lower right third molar that was extracted 10 years ago. I got rid of the infection, the congestive heart failure totally disappeared. We had another patient, emphysema on steroids for over a year. I tracked it down to a strep infection in an edentulous area in the bone where a tooth was extracted 15 years ago. We got rid of the infection with biofrequencies and nutrients. The emphysema totally cleared up. When you start to understand the connection between the mouth and the rest of the body, you will get so excited, and you won't have to worry about marketability of your practice. I have patients that fly in from all over the world. Why? Because they read the website, they see the connection, they're tired of getting beat up on, and they're going to come to people who have answers. And you people have the tools to solve these problems. You just have to refocus your knowledge and make the connection. Scientific documentation of the whole body, the dental whole body connection. In the year 2002, we had an article published in a peer-reviewed journal on the dental orthogonal radiographic analysis. It's the first system in the world to radiographically document cranial bone changes from external manipulation. For those of you who want to read it, it's on my website, icnr.com. But basically, I did before and after radiographs. The key to my system that I put together is you can reposition the head 10 minutes after you take the original radiograph, 6 months or 6 years, and get the same head position so you can do the analysis. And basically, it says this study concludes that the cranial bone mobility can be documented and measured on X-ray. Dr. William Crow, who was the head of manipulative medicine at PCOM, Philadelphia College of Osteopathic Medicine, is in the process of, he's applying for an NIH grant to take my system to the next level. So what does it look like when you're dealing with a PA view of the skull? Well, here's a patient of mine, Mark Blatstein, is also a good personal friend. 14 years of chronic neck and lower back pain. He fell through an elevator shaft 2 stories and was in a body cast for 7 months. I said to him, Mark, what'd you learn from the experience? He said, Jerry, I learned that I couldn't fly. Basically, he was a victim of 4x amputation retraction orthodontics, which really sets you up for major problems. He basically had compression between the atlas and the axis. And when I did my evaluation, when I put in the thickness of 2 sheets of typing paper on the right side between his posterior teeth, the second bicuspid and first and second molar, he tested strong. So we put on shims. You know, carpenters use shims to level what? Floors, windows, doors, and cabinets. Well, we as dentists can do the same thing. With a thin shim, the thickness of a sheet of typing paper, I can rebalance the cranial mechanism and the sacrum. And that's what we do. You know, I don't use many appliances anymore for TMJ. You know what TMJ stands for? Too much junk. The bottom line is, if you know how to tweak the body, you don't need the appliances. You put the cranium back into balance, the neurology straightens out. How in the world can you center a condyle in a door frame that's crooked? The temporal bone can rotate. And if it rotates in an external rotation, the condyle goes posterior immediately. How are you going to nail the center of the fossa when you have a distorted door frame? It's impossible, people. And that's why there's so much controversy with TMJ, TMD, and those other related aspects, because they're not seeing the global picture of what's going on. If you have a pronated foot, it's going to cause the contralateral temporal bone on the opposite side, basically, to go into external rotation. And you have a torqued mandible. I don't care how many appliances you put in that patient. If you don't straighten the foot problem out, you're not going to straighten the TMJ out. This is documented stuff, people, and I didn't make this stuff up. Within 24 hours of putting in thin shims, the cervical pain disappeared, and 6 weeks later, the lower back was 75% better. And you can see the decompression that occurred in the atlas and axis area after the shimming process. See, this is documentation. This is not hearsay. Here's a woman who had 35 years of headaches, 3 years of right thigh pain, resolved in 1 hour. We did a cranial manipulation. You could see pre-treatment, the space is unequal here at the dontoid process. There's compression here between the atlas and axis, and limited jaw opening. Once we did a cranial manipulation, you have more space at the dontoid process, decompression of your atlas and axis, and the jaw can open so much further. Simple, gentle manipulation. My motto now when I practice, less is more. Less is more. Like homeopathy, the more dilute the solution, the more powerful it is physiologically. 20 years of facial pain. You can see that this woman, she was a Mennonite. She got thrown from her buggy, hit her teeth on the fence, knocked it out, and the dentist made a 10-unit fixed bridge. If you look at this thing, I cringe when I see this because there's a distortion here, people. This is 1 unit. This is, you heard of the movie Man in the Iron Mask? Well, here you got a woman in a dental mask. When you bridge that midline with fixed bridge work, you're locking up the entire cranial mechanism. You see the distortions here? We're going to point them out to you one by one. But there's the maxillary transverse plane, okay? There's a cant to the maxilla. It's high on the left side, okay? And everything else goes crazy. It's like puppet strings. Whatever's distorted above, so goes below. After I cut the midline here, it sprung apart. We did a cranial manipulation. The plane went more level. Horizontal plane of the atlas was canted. And let me tell you, people, when your occlusion is crooked like this, your atlas is crooked, and your sacrum is also crooked, and your pelvic bones follow suit, like the puppet. Because the dural membrane system that surrounds the brain goes through the foramen magnum, attaches the upper 3 cervical vertebrae, and then tenaciously attaches at the second sacral tubercle, is the cranial sacral system. When the puppet is crooked above, so goes below, and vice versa. After we cut the bridge and the cranium was released, the atlas went more normal. Transverse plane of the orbits. Again, everything is canted from the distortion. This dentist literally locked this patient in for 20 years with constant facial pain because of lack of knowledge. The orbits straightened out. The palatal arch, look at the shape of the arch. This is external rotation. It's flared out. After we release the bridge work in the cranium, you have a more normal shape to the palate. The position of the nares. You have the left nares is high, the right is lower. It's canted. It follows the distortion. The turbinates also get affected and affects breathing. Once we release the mechanism, the nares are straighter. Transverse plane to the mastoids, canted, high mastoid, and what's that do to your SCM, your sternocleidomastoid muscle? It puts tension on it and it goes into spasm. You can treat the muscle till the cows come home. If you don't level the cranial mechanism, you can't release the muscle. You can do trigger point injections all you want. It's great to generate income, but you're not going to solve the problem. Once you straighten out the cranial mechanism and release the bridge work, you get a balanced mastoid. The spinous process of C3, right here, it's way off to the right side, okay? Once we release the whole mechanism, it's straightened out. This is the power of dentistry, people. If you understand what you're playing with, you could do some phenomenal things. So this 20 years of facial pain was resolved in 1 hour. This looks like a serial killer. Would you let your daughter go out with this fellow? He was a victim of 4-by amputation retraction orthodontics. This is Neanderthal orthodontics. What you're witnessing here is sympathetic dominance, people. You see the distorted structural here, the sphenoid bone, the frontal bone, the head posture. Vasoconstriction from jamming up the sutures and torsioning the human skull. 6 months of ALF treatment, taking the torsions out of the head and nutritional support. We have a totally different human being. He was perfectly normal at 12 years old, and when they extracted the teeth and put headgear on him, he couldn't walk because it affected his motor and sensory neurology when you start jamming up and torsioning the human skull. When you do 4-by amputation, and it is amputation, it's not extraction, it's amputation, and you retract those front teeth, it's just like a head-on collision in a car. You get buckling in the middle, and you get a twisting effect because you have to dissipate the forces of bringing those front teeth back. Compression causes buckling and twisting. The same thing happens to the human skull. Here's a case, 14 units of rigid connector. You got a butt joint here, and it's beautiful jewelry, people, but physiologically, it put this patient into a tailspin. We cut the bridge, released her cranium, and you can see that 46% of your motor and sensory neurons of the cerebral cortex relate to your mouth and the face. Locking the maxilla with fixed bridge work has the potential for producing neurological and physiological deficits throughout the entire body. She wanted to sue the dentist. I said, well, you have nothing objective to go by, the document. So I sent her down to the audiologist, who was downstairs from my office at the time. The first two frequencies of hearing, 125 and 250 decibels, were at a 20% deficit. We cut the bridge, then had the hearing test redone, and the hearing went back to normal. The same thing occurs with a nitinol wire in orthodontic brackets. You're affecting the hearing mechanism, people. I've documented it. This is real deal. This is physiologic dentistry. This is the church of what's happening now. Anytime you put a restriction on the maxilla, you're impacting on the physiology of the human body. It's just that we weren't taught these things in school because they don't even know that they don't know. That's the frightening part of the whole scenario. 42-year-old patient had all this gorgeous jewelry done in her mouth, and she wound up, the first 5 symptoms related immediately after the bridge work was put in. Constant hatband headache, facial and cranial tightness, generalized feeling of stress and irritability, upper cervical and neck pain, limited range of motion. Then within the next 2 to 3 weeks, she developed disequilibrium, generalized chronic fatigue, because you remember Hans Selye's work from 1936. Structural, emotional, or chemical distortion affects the adrenals the same way. You have DDS, dental distress syndrome. You have a structural abnormality in the mouth. The adrenals are firing. They get wiped out. And that's when your allergies come in to be, your lightheadedness, digestion problems. Okay? Generalized muscle weakness, progressive. Again, weak adrenals, low blood sugar problems, paresthesia of the arms and legs. Because when you lock up the cranium, you're locking up the cervicals. Where's your brachial plexus nerves come through? Your anterior medial scalenes. When you disturb the upper cervical function and you get entrapment, there goes carpal tunnel and numbness and tingling down your arms. Parallel planes. I learned this from the osteopaths and chiropractors. Everything in the body has to work on parallel planes. Your eye plane, your ear plane, shoulder plane, elbow plane, pelvic plane, knee plane, ankle plane, and your maxilla must also be parallel to the other planes. If it's not, you're creating problems. The maxilla, which is anterior 2/3 of your cranial base, is your balancing mechanism for your entire skull, foramen magnum, TM joints, atlas, spine, and pelvis. The orthodontists always talk about the maxilla as being the anterior 2/3 of the cranial base, but that's where they leave it. Trust me, people, you start looking at your chronic pain patients, the patients that have the most medical problems, their maxillas are canted. They're disturbed. And that sets the patient up for structural and neurologic dysfunction. Al Fonder showed this many years ago with a 0.5 millimeter support on the second molar. Okay, within an hour, you see the spine, the scoliosis changes. You see the kyphosis on the upper thoracic decreases, all from a 0.5 millimeter support on a second molar. So when you start throwing in these appliances that are jacking up the vertical 4 millimeters, 5 millimeters, you're impacting that whole spine. It may be for the good, but it also may be for the not so good. There's a biofeedback mechanism, the outside of the skull to the inside of the skull. You have your falx cerebri, that's your vertical sickle from the crista galli here to the back of the occipital protuberance. And then you have your transverse membrane, your tentorium cerebelli. These are tent poles, as Desjardins would refer to. He was the founder of the SOT, sacro-occipital technique. They balance the skull bones. Stimulation of pain receptors in the intracranial vault initiates impulses in the fifth cranial nerve. That's our jurisdiction, trigeminal, causing referred headache to the front half of your head. This is in the Bible. Arthur Guyton, Textbook of Medical Physiology, 6th edition, page 622. Anytime you start messing with the occlusion, you're directly impacting on the dural membrane system, which is innervated from sensory branches of every division of the trigeminal nerve. This is what's going on, people, when you got malocclusions, compressing the maxilla with orthodontics, extracting teeth and impacting them. Your reciprocal tension membranes above the tentorium are innervated by your sensory branches. Below the tentorium is C2 and 3. So balance of the maxilla is critical for maintaining total structural integrity. You look at your full denture patients that have problems with their low back, their hips. You look at the maxilla, I guarantee you the plane is off. Because when they set up the teeth, they weren't using an oculighter instrument to get a reference points to the horizontal plane. So basically, your whole integrity of your craniosacral system is impacted when the occlusion is off transversely or sagittally. Your dental complex, via the occlusion, provides a self-correcting mechanism for balancing your skull bones. If you walk away with no other point from this whole seminar, memorize this one. The dental complex, via the occlusion, provides a self-correcting mechanism for balancing your entire skull. 3 basic principles of occlusal revision. 1, you want to correct the cranial bone distortions. 2, correct the maxillary cant. 3, align the teeth to stabilize the cranial mechanism. This is a suture, people. Sutures are expansion-contraction joints of the skull. If you don't have it, you're in trouble. Every architectural structure that's built on this planet has expansion-contraction joints in it. The world, it was the Empire State Building has a 2-foot sway pattern to it. It would break if it didn't. That's what these sutures are there for. The key to the whole cranial mechanism is this malar bone. If you have to disarticulate a human skull, this is the first bone that must be taken out in order to take apart the whole skull. And when you're doing your orthodontics and expansion or changing the occlusion and it jams up this malar bone, it restricts the whole skull. The malar bone is key to releasing the entire skull. A balanced occlusion frees up the malar, and that's what our objective is. The occlusion represents the self-correcting mechanism for correcting the entire skull bones. These are expansion contraction joints. They move, people. Don't kid yourself. And when your occlusion is off, you get distortions of your temporal bone. Your condyle cannot function properly in there. You get popping, clicking, and pain. The process is repeated 2,000 to 2,500 times a day. Okay? If you look at the human skull, it's a living organism. The skull bones are not fused. They remain open until the 8th or 9th decade of life. They contain living tissue, as documented by the histologic section. Note the viable tissue anchored into the adjacent bone, right here. You got Sharpie's fibers, goes into the soft tissue in the suture, locked up into the cranial bone. The sutures provide expansion contraction joints, allowing the skull to accommodate to structural changes. That's what saves most dentists. They have that leeway of adaptability. The internal dural membrane system communicates with your external surface of the skull by means of the periosteum. This protective layer contains fine nerves and lymphatic vessels. This is in Gray's Anatomy. I didn't make it up. The dura that goes around the brain goes out through the suture and forms the periosteum. So that's why when you have cranial distortions, you're affecting the neurology of the brain. So a malocclusion, inadequate occlusal revision, or occlusal equilibration can distort muscle balance. When that occlusion is not right, you get an imbalance of the muscle. If the superior head of the external pterygoid goes into spasm, it pulls the meniscus anterior medially off of the head of the condyle. You got TMJ problems. So a dyspneic barrage of signaling occurs 2 to 3 times per minute with contact during swallowing. The key here is a balanced occlusion. Balances through the pterygoid sling, which I've coined, your sphenoid bone, your internal pterygoid, and your external pterygoid. And there's an anatomical functional interrelationship between the mascatory muscles and the pelvic muscles. The internal pterygoid relates to the contralateral psoas muscle. The psoas muscle is the only muscle in the body that attaches to the intervertebral discs. So this is why if you have a spastic internal pterygoid, you can impact on the psoas and cause lower back pain. And I've resolved many lower back pain by straightening out the occlusion, release the internal pterygoid, and the psoas calms down. There's a relationship between the mascatory muscles and the pelvic muscles. Raymond A. Dart, back in the 50s, he was an anatomist in South Africa, in Johannesburg, showed a double helical arrangement of muscles between the base of the occiput and your pelvis. And that's why the body corkscrews when you got occlusal distortions. Dental revision. Occlusion provides a self-correcting mechanism for balancing your cranium. I'm going to sound like a broken record, but this is, you have to understand this paradigm. Here was a case, woman, she flew down from Canada. She had all her mercury fillings replaced 25 years ago and developed facial pain immediately following the revision because her cranium was torqued. The bite was not balanced to stabilize the cranial mechanism. She had loss of cranial balance due to faulty revision of the occlusal table. Treatment, occlusal cranial balancing was done. One shim was placed, the thickness of one sheet of typing paper, on the lower right first bicuspid tooth. The 25 years of facial pain disappeared immediately. This woman suffered 25 years of facial pain because of lack of knowledge. Deb Taylor, another patient from Canada, underwent mercury revision and dental revision, mercury removal rather. She had 3 inlays placed on the maxillary left quadrant by a board-certified prosthodontist. Immediately following the revision, the patient developed severe facial pain, which persisted for 6 months. The pain was so severe the patient wanted to commit suicide. It took me 5 visits to restabilize her cranium and her body. The torsion and the loss of cranial stability due to faulty revision of the occlusal table was the problem. Nutritional support was provided to calm down the sympathetic nervous system. You can use vitamins. You don't need drugs, people. Vitamins, if you know what you're doing, can calm down the sympathetic nervous system. It's simple. You just have to know what you're doing. The occlusal cranial stability was achieved with 4 shims, the thickness of one sheet of typing paper on various teeth. 5 visits to get this patient out of pain. When you have a malocclusion, you're going to get a vasomotor response. Documented with thermography. Here's your masseter muscle. It's hot on the left side. 2 shims were placed on one side and 3 shims on the other side of the bite. 6 minutes elapsed between 11:56 and 12:02. And the temperatures of the 2 muscles went to balance. 6 minutes after putting shims in. The occlusion impacts on the vasomotor response of your head and neck area. Documented. Here's a young lady that had severe astigmatism in the right eye since 1994. In 96, the ophthalmologist documented a minus 0.75 diopters in the right eye, minus 125 in the left eye. In June of 97, we put in an ALF appliance, which is designed to rebalance the skull bones. In 4 months' time, I rebalanced the sphenoid bone. The lesser wing of the sphenoid has the attachment of all the muscles of the eye with the exception of the superior and inferior oblique muscles. When the sphenoid is crooked, it changes the muscle balance to the eyeball. When the eyeball shape is distorted, it affects the lens of the eye, people, and you have astigmatism and focus problems. In 4 months, with ALF treatment, stabilizing the sphenoid bone, her severe astigmatism reduced 66 2/3%. The ophthalmologist told me that this could not happen by accident. And invariably, when we rebalance the occlusion and the cranial mechanism, their prescription on their eyeglasses have to be dramatically reduced, sometimes by 50%. Typical case scenario, a dentist inserted a 5-unit anterior bridge. It was too thick. The mandible got retruded, causing an occlusal interference on the lower left second molar. The dentist equilibrated the distal buccal cusp of the lower left second molar because that was the easiest thing to do. Unfortunately, he put the patient into a 14-year tailspin of dysfunction. Iatrogenic effect, removal of what most dentists would consider as an insignificant amount of support from just one area of a cusp, triggers off a domino effect, causing the maxilla to go into internal rotation. It caves in, people. It drops. And that affects the dura. So here we have condylar position, compression. You get some beaking, okay? But what does tomographs tell you about cranial lesions? Nothing. We have all kinds of sophisticated documentation, but no one's really getting to the core issue. What is the occlusion doing to the balancing mechanism of the human skull, which is the housing of your whole computer system? When the computer goes haywire, so goes the rest of the body. She had some moderate osteoarthritis and a leaning tower of Pisa here. Again, when the occlusion gets goofed up, so goes the cervical vertebrae. Now, this woman was seen by Harold Gelb, and I know Harold, and he's a genius. He's done a lot of good for dentistry. He couldn't figure it out. She went up to see Terry O'Shaughnessy in Boston. He couldn't figure it out. She spent a week down at Upledger Institute in Florida. They couldn't figure it out. The reason being is that because it's a complex case. When the dentist ground down the distal buccal cusp of that lower left second molar, they lost support to the cranium. And the maxilla went into internal rotation on that left side. When it got compression, she couldn't tolerate the bridge work. So she made the dentist take it off, which then she lost more cranial support. It caved in even more and set her into a 14-year tailspin. To solve the problem, I had to do overlays to correct the horizontal plane. Because when you build a house, people, the first thing you do is straighten the foundation. If you don't straighten that maxilla, you're whistling into the wind. It's the foundation of the human skull and the body. If that maxilla is not straight, no matter how many appliances you put in the mandible or upper, you're not going to get stability. So we did overlays, then an ALF appliance, bonded it in, and then we had to go on a 6-year journey to restore Humpty Dumpty. I had to rebalance the cranium, take the torsions out of the head, then she could tolerate some temporaries. Then we did orthodontics to realign the teeth to stabilize the cranial mechanism. Margaret Frost presented this picture to me in 1985. That's when she had the bridge work put in. That's what she looked like, a vivacious woman that had a quality of life. That's what she was turned into by grinding one simple cusp down on a second bicuspid tooth because it had a neurologic interference and lack of cranial stability. It took me 6 years to reestablish cranial balance and occlusion, and she walks faster than her husband now when she goes out. See? If Al-Qaeda would use the techniques of conventional dentistry, they'd be infinitely more effective in inflicting pain. And that applies to medicine too, people. Here's a young woman, 32 years old, presented with headaches 2-3 times a week for 3 years, short span of concentration, low energy for 8 years, not sleeping well, grinding and clenching. I'm finding clinically that grinding and clenching can be caused by parasites, but it can also be caused by occlusal interferences and the body's reflex mechanism for trying to force the skull back into a balanced position. Because once we reestablish occlusal cranial balance, the patient stops grinding and clenching. It's a reflex activity. So cranial adjustment and placement of one shim. Now, this is not a whole lot. All I did was fill in the gaps to give the tooth proper support to the cranium to force it back into a neutral position and balance. So the results in 6 weeks, the headache's completely gone, span of concentration greatly improved, energy level dramatically increased because the adrenals don't get wiped out, sleeps more soundly through the night, and stopped grinding and clenching. As simple as a little support on one tooth can change that person's life. Here's a patient that had 10 years of right side facial pain, defied all attempts at treatment of resolution by medical and dental. Underlying problem, occlusal instability, which torqued the dura, created imbalance of the sutures, and the right side of the masseter. Your basic anatomy, people, 5 branches of the facial nerve pass over the masseter. When that goes into spasm, you have facial pain. This is the exact distribution of the facial nerve. We put a support on one tooth. See, and the technique that I teach, you can test. You can put in a shim of paper in the right coupling of teeth and feel the indicators, and within 30 seconds, you know if what you did is right. She had pronated feet. This is where the arch caves in. And this was a descending lesion. In other words, when I corrected the occlusion and the cranium, the feet went straighter. So you can have a descending lesion, malocclusion, cranial distortions causing a foot problem, and you can also have the reverse, where you have an ascending lesion coming from a pronated foot affecting the temporal bone and jaw. Occlusal cranial balancing provides one of the major missing links in establishing total health and resolving chronic pain. Biological dentistry will be the next major super specialty in medicine once you learn how to do it. We have more control of the entire body than any other specialist in the world, more than chiropractors, osteopaths, neurologists, anybody. If you understand that correcting the occlusion, taking the toxic metals out of the mouth, taking care of infections in bone, you're going to change the physiology of the entire body. For those of you that want to learn more about what we're doing, we have our website, we have our seminars listed, we have testimonials on there, we have 40 cases on there that show you the direct relationships. We had one woman with 34 years of severe rheumatoid arthritis, started 1 year after she had a root canal in an upper left lateral incisor. She had a strep infection in the tooth, and age 29, age 30, rheumatoid started in their knees. 34 years suffered. They had her on methotrexate, prednisone, and Enbrel. Enbrel is a drug that's known to cause cancer, and it costs $13,500 for one medication for 1 year's worth of prescriptions. We put her on a Rife technology. We got rid of the strep infection in the tooth. The 34 years of rheumatoid arthritis totally disappeared. So if you want to get to our website, it's dentalwholebodyconnection.com. You're more than welcome to use any information on my website to educate people of what dentistry has to offer. It's powerful, extremely powerful. We have occlusal cranial balancing technique. It's a video that we recently put together, professionally done, to give you an understanding of what's involved. Okay? We have seminars, if you're interested. We have one coming up in Canada in April. We teach you how to get to the core issues. You just can't shotgun people with supplements. If you're doing detox for mercury, you just can't say, here's a standard protocol. Everybody who walks in the door gets the same protocol for mercury detox. It doesn't work that way. Every supplement has an energy pattern to it. If that energy pattern does not correspond to the energy pattern of the patient, you will not get the maximum effect of that supplement. This is how I've been able to get outrageous results with patients, reversing congestive heart failure, reversing cancer, reversing all kinds of maladies that medicine is still scratching their head about. So it's on our website, and I thank you very much for your kind attention.